And now to health matters. The Nigeria Center for Disease Control and Prevention has confirmed 8 new cases of Mpox in the country, with fresh cases recorded in Gombe, Plateau and Akwa Ibom state. So far, 67 cases have been confirmed in 23 states and the FCT out of 1,031 suspected cases from 35 states and the FCT. This was disclosed during a press briefing in Abuja organized by the Director General of NCDC, Jide Idris. On cholera, the agency said it has recorded 141 suspected cases and 1 death, with a case rate of 0.7% fatality in Katsina, Lagos, Kano, Jigawa and Adamawa state. Now, so far, 216 deaths have been recorded from a total of 7,663 suspected cases in the country. Now, to discuss this, we're joined by a public health expert, Dr. Matthew Okoh. Thank you so much, Dr. Okoh, for joining us.
Thank you very much. It's always a pleasure being with you.
A pleasure having you join us as well. Now, given the ongoing Mpox outbreak, what specific strategies can be implemented to prevent the further transmission and, of course, to ensure control of the spread of the disease in Nigeria?
Okay, so the first thing is, for people to be aware of, that we have this outbreak that is ongoing. And very importantly, people need to be able to identify this infection in individuals. And then they need to understand what the steps, that people need to take. As you know, this is a viral infection that is transmitted from, the interacting with animals that have been infected or eating poorly cooked animals. Again, we have human-to-human transmission by, very close contacts with the human, and as well as respiratory droplets, as I can see, including touching items that these people have touched. So if an individual who has contaminated surfaces or clothing, and then other people, gets to come in contact with these items as well, they run the risk of, becoming infected as well. So the very first is to be understanding that this disease is out there, and then understanding, one, how to identify it, and then two, what they need to do if they have a loved one or a friend who has become infected, like I just explained. So understanding the different things, that the different ways that it can be transmitted, helps you to take precaution and then prevent yourself from becoming infected. Then we have, on the larger scale, you have the government, where this ailment is something that is vaccine preventable. So if we are able to roll out the vaccine, even though at the moment the recommendation is for people who have close contact with those who have been, affected by this ailment. So vaccination can, play a big role in helping to keep this under check.
Now, what would you say are the most effective measures to mitigate the impact of the outbreak and prevent future outbreaks as well? I know that you've given some of it, but how can the government and health organizations ensure access to clean water, for example, and sanitation facilities in these affected areas?
Okay, so this ailment is, like you mentioned, is a disease of that has to do with hygiene, and because proper handling of animals is one thing. Two, washing your hand with soap and water, and where you don't have soap and water, you can use sanitizer to wash your hand properly, and then maintain hygiene. With respect to access to clean water, again, that is something that is ongoing. It's a developmental issue that needs to, a structural issue that the government will need to look into. But as it concerns, this is more of a problem with cholera, like I did hear you mention in the course of this news. But with Mpox, the strategy, right? What people need to know is to properly prepare the meal that they eat. That's when we talk about dealing with animals right now that might be infected, and then preventing human-to-human transmission. So creating awareness is one good strategy, because if people know how they can protect themselves from this, then the chances that they're going to come down with it is very, very low. with the assumption or expectation that they will listen to the advice that government and its agency has given, have provided.
All right, still talking about public health infrastructure, how can Nigeria strengthen this area to better respond to and manage future outbreaks? What are some of the key investments that are needed to improve things like surveillance, diagnostic capacity, and emergency response capabilities as well?
Yeah, so unfortunately, Nigeria as a country have been in the response mode for quite some time. So it's time to move to what we call emergency preparedness, right? So, like you mentioned, which includes strengthening surveillance systems. So we have manpower needs, right? We have about data, right? Being able to transmit data from one place to the other is a very important factor. So there are people that we call disease notification or surveillance officers who are based in different areas within the country. So these people we need to have these people properly trained. We need to have these people being knowledgeable and what know what to look out for, how, and we're working hand in hand with healthcare providers, because these people normally would present in the health facilities first of all. So high index training healthcare providers to have high index of suspicion, knowing what steps they need to take in the find suspected case, quick transmission of information to the notification officer within the state, who also we need to do that up to the federal level, right? So these are some steps that that the government we need to take, in addition to strengthening the systems that are required in terms of data management. So surveillance is very, very important. It's very key in this process. So it is really very important to deal with the manpower need with respect to this, and then making sure that the facilities required to make this happen is available. Then, of course, we know all this will boil down to funding, right? So we keep talking about inadequacies in the budgets, particularly with respect to health budgets. We need to begin to look into that very seriously.
All right. Thank you so much, public health expert Dr. Matthew Okoh. Thank you for joining us to discuss the outbreaks and, of course, how it can be curbed.